Hello and welcome back to Ventura County Works. This is Doug Foresta, and of course, with us back today is Rebecca Evans,
Mm.
Executive Director of the Workforce Development Board of Ventura County. We also have a return guest. Today's conversation is part of our industry spotlight series. We're focused on the healthcare industry, which is one of the largest and most critical employment sectors in Ventura County. Healthcare touches nearly every community member, yet it faces both unique workforce challenges and opportunities. And to help us understand those trends from a provider and systems perspective, we're proud to welcome back Celia Daniels, founder and CEO of Rebekon Consulting. Rebekon works with healthcare organizations on workforce, learning strategy, leadership development, and helping teams thrive in a changing environment. Rebecca, Celia, welcome.
Thank you. Thank you, Doug. It's a pleasure being here.
Thank you. Thank you so much, Doug. And thank you, Celia, for being back with us. So we're going to go through a few questions related to the healthcare sector,
Mm.
specifically. And I know this is something where you have a lot of deep knowledge and you're working in this sector through your consulting work, as well as serving on the Workforce Development Board here locally. So to begin, can you tell us and tell our listeners about your role at Rebekon Consulting and how you engage with the healthcare workforce specifically?
Absolutely. So thank you, Rebecca, and thank you for giving me this opportunity. So as part of Rebecca Consulting, one of the things that I focus on is to bring the healthcare awareness within the four pillars of healthcare, which is I call it the four Ps: the provider, payers, pharmaceutical companies, and the policymakers. So, if you want to make a change in healthcare, you have to also concentrate on the four pillars of healthcare in order for us to bring these changes. And that's what I'm focused on from Rebekon Consulting. I'm the CEO and founder of Rebekon Consulting and started working with so many organizations, including the provider industry, the pharmaceutical industry, started working with the policymakers, implementing HIPAA in the early 2000, way back in 2001, I believe. So a lot of times there's so much of areas that I've touched, and I have more than 30 plus years of experience in healthcare and life sciences industry in the United States, and a little bit of experience back in India as well. So that's my background.
Thank you for that. And healthcare is such a vital sector here in Ventura County. And especially in recent years, we do know that it's one of the most in-demand industries here in Ventura County. At the Workforce Board, we have a healthcare sector working group that meets virtually every other month, bringing together our education and training providers with employers and healthcare providers so that we can understand what those needs are and make connections between the two. So it's something that our board is definitely paying attention to. So why do you feel that this discussion around the workforce needs in this important sector are so important right now?
Healthcare is one of the important areas for a human being. Health is everything. It's not all about economic empowerment is important, but at the same time, health is a critical part of every human being, and especially as when you're focusing on Ventura County, we have close to probably 900 plus 900,000 plus individuals in the county, and a lot of them have different needs in terms of healthcare. And health equity is also one of the key areas that we started focusing on. Is also while we are focusing on healthcare, how do we bring healthcare to all the employees, to all the citizens, or all the folks who are part of the Ventura County? It's very important for us to bring that awareness within our provider network, the payer network, and also with all the insurance companies and also the pharmaceutical companies within Ventura County. So this is one thing that I have looked at it much closely because I was doing consulting for some of the organizations here, just not to name a few companies, but one of them was Amgen. Did a lot of work in the health space, but also focused on clinical awareness and bringing that kind of diversity and looking at clinical care in a much better way with a patient-centric program. So I believe that every patient, every human being is a patient, and how do we create that ecosystem of care around that patient is where I'm focused on, and that's my key purpose. And I feel I've gone through a lot in my life as well. Especially my mom was a nurse, and the way I grew up was always healthcare was part of our discussion while growing up. I've always been in the hospital, just picking up my mom, or just was sitting there looking at patients and learning a lot. It really helped me to focus on how can we not only focus on healthcare for ourselves, but also for someone else. And that's what I learned actually when I was young. My mom and dad, they used to take us to the nearby rural areas back in India, where my mom used to take medicines for the community there. And she arranged medical camps where we did that kind of activity. And I was just there to entertain the kids and to just rile up the village crowds and the people to come and get healthcare, free healthcare. And healthcare was always like a simple thing for me in my head is healthcare is free. Healthcare needs to be given to everybody. You cannot deny healthcare. And that's how I look at it. Things quite changed in this country, and we can talk about it in a little bit. But for me, one of the reasons why I do what I do is because of the I would say the milestones are the awareness that my parents and the community that I lived in, especially in India, healthcare is never denied for anybody who comes to the doctor looking for healthcare, even if you have socioeconomical status. So it's very critical, especially in our county. We have a lot of underserved communities. As much as we are taking care of them from an economic empowerment standpoint, we also need to make sure that they have the right healthcare. And what we can do to remove all the challenges, the barriers to make sure that they get the healthcare is absolutely critical. And that's why I'm so excited that even within our workforce board, we have a health equity group where we focus a lot on the healthcare committee and decisions that are being made. So it's a really critical thing for me as well.
Yes. So it sounds like even from early in your life, you had that emphasis and that view of how important access to healthcare is for everyone. And it's interesting that I think wherever you are, that continues to be a priority and something that local communities grapple with sometimes. And we're taking a look at that, right here. So, from a workforce perspective, talking about that for a moment, what do you see are the biggest workforce needs and challenges for the employers in Ventura County?
I think some of the challenges we are having, it could be based on the economic the issues that we are going through in the country. It could also be, it could differ based on the employees, the employers trying to keep their, I think, just focusing on some of the areas like what is really core versus what is commodity. That's one of the things that the employees grapple with. A lot of times the commodity is being outsourced. Sometimes the commodity is being given to a different place or in a different country or even to AI. There are a lot of ways in which their commodity is being taken care by the technology, by AI, or being outsourced to different areas. And so it's really important looking at I would say, some of the vendors within, or the vendors or the employers who are part of the Ventura County are starting to grapple with how they are able to manage the economic downturn that's going on or the changes that are going on in the government that can directly affect these jobs. And especially now we have seen that so many, even within Ventura County, the key thing is farm workers. Now we are looking at the farm workers because a lot of the revenue that comes from the the ag industry, the agriculture industry is very critical. So we are looking at a lot of areas where we want to retain and also focus on how do we keep the employees and the labor within Ventura County. But we have also seen some issues that are happening in the country that is directly impacting some of the farm workers, especially with the immigration policies and the changes that are coming in, which is actually causing a little bit of a downturn there. And we also started thinking about what the employers are now doing is they're starting to think about how do you retain employees in the workforce? Because a lot of times we recruit people, but we don't retain them. There's a lot of attrition that happens. And so the focus needs to be R&R, recruitment to retention. And how do we do that? How do we make sure that the employees are they feel that they belong to the company? So there are some challenges that they go through. They're coming out of that they're coming out of that commodity mindset where they are thinking that my employees are my assets and we need to work with our employees and also make sure that they retain that knowledge and the experience that they've gained within the county. And we do have these discussions all the time, especially with our the business owners. We talk about how can we raise more jobs, bring more jobs within our county. How can we make sure the younger generation are being utilized in getting them into the workforce. So we talk about a lot of times building monuments to ourselves, but now we are looking at a pathway. So workforce development is actually paying a pathway for the younger generation and just not being just building monuments for ourselves. And I think that's what a lot of companies have started looking at the younger generation. They are looking at how do we retain them and how do we motivate them? What do we need to do to empower them in the workforce? So we have seen quite a lot of changes even within our county, where there's a lot of emphasis on younger generation and how do we focus and make sure that we keep the jobs in our county, we keep the jobs in Southern California, and retain that kind of employment opportunities within Ventura County.
And the healthcare sector being a place where family sustaining wages are achievable. Like a career in healthcare can give someone a higher pay rate than some other industries, for example. And that's not just at the doctor and nurse level, but there are so many different occupations within healthcare and opportunities for advancement in different areas.
Yeah.
Uh, so one of the things we'd like to do now, and we're kind of borrowing this from our board member minutes series, is some rapid fire questions, like some quick, and then we'll get back to some longer form. But are you ready for a few quick ones? Okay. All right. One skill that healthcare employers need more of.
Compassion or people skills.
hmm Absolutely. I was thinking earlier when you said, that the person-centered design and then treating the employees, not like a commodity, but as a true resource and having a relationship. And like one of the things I know I've said at work just quickly is if we are going to practice human-centered design with our customers, we also need to practice that with one another in the workplace and to model it. So that really is core to our leadership. One misconception people have about careers in healthcare.
They think you need to have a degree in healthcare.
Mhm. Yeah, and you don't necessarily need a traditional
Yeah,
degree. There are lots of
you know,
training programs and certificate programs. Good one.
absolutely.
One role in healthcare that deserves more attention.
I would say research.
Research. Yes. And one thing that excites you about the future of healthcare work.
What excites me is the advancements in technology has really helped in finding cure for cancer, like
Mhm.
immunotherapy. We have T cells now, and a lot of that. So I would say more on the research side and the technology and I would say technology, healthcare related technology, not necessarily AI, but healthcare related
Mhm.
technology.
Mhm. Great. Well, thank you for those insights as someone who works with a variety of healthcare organizations. So, looking across that industry, what strategies have you seen be successful by employers in strengthening their workforce and getting the employees that they need?
I think the fundamental way I did talk to you about this is the employers always have a way in which they need to treat their employees as an asset. to the company
Mhm.
and an investment. They need to invest in their employees. And that's where Workforce Board does a lot of trainings to even prepare them for this kind of workforce. We have a lot of scale upskilling that happens in schools, right from schools to colleges, even after you're displaced a worker. There are a lot of ways we do that. And it's really important to also focus on first is training the employees and making sure that they're always upskilling themselves in the workforce. And the other important thing is recognition in terms of both in terms of salary and also in terms of their skills and their contribution to the organization. That's one thing sometimes people lack that a little bit. And also the knowledge, especially, is retained within folks who are part of the employers, I would say the core team. And that's where it's really important to keep your core team when the ageism sometimes can happen because you have a lot more knowledge in a particular area and you're probably in your about 50 and the employers start you know I think they go through this process of bringing in new talent within the company, just looking at better talent within the company, but that doesn't mean that you bring in all the younger generation and get rid of the older generation. It is a good combination of both needs to work together. And I've seen that combination work really well, where you bring in a lot more talent within and then more creativity. Focus on creativity rather than looking at it from an ageism or a particular group. Like when we look at inclusivity in terms of different folks from different backgrounds and that has really helped in these organizations because we know that the McKinsey research and some of the research that we have seen that the more diverse your workforce is, you bring in a lot more talent and you bring in a lot more ideas. So I think that is really important for the organizations, and it has always been that way. Where you in California, we focus that a lot. We have a lot more diverse workforce, and that really helps in bringing diverse ideas and improving the productivity in the organization. It also keeps a good balance and a check in terms of just leaning towards one particular demographics within the workforce. I was having a discussion with the police officer recently in Simi Valley. I was just asking him a simple question. This was because I was more interested in the diversity within the police force for various reasons. So when I was chatting with him, I was asking him, so why is your police force not diverse? You seem to have a lot more Caucasians rather than the other communities, and we have a large population of Hispanic community here and more Asian community. Then he said in the area that they're focusing on, we don't have too many people who apply for those jobs. And it was interesting for me to listen to that. And I said, what can we do to bring more diversity is to also show that the recruitment can be done in different areas. And we need to also campaign for that. Then there is work within the police force, and there's a lot more opportunities that can be brought in. And sometimes we think that, like the myth we have in the workforce segment is, sorry, in the healthcare segment is you need to have a healthcare degree. Actually, it is not. You need to, when you're in a lab, you just learn about all the work that you do within the lab and administrative work that you can do. And a lot of that can be brought in even in the other areas within the Ventura County, especially when you're working with different departments we have. And there are a lot of areas we can bring in those, even in the Department of Rehab, Department of Juvenile Justice. There's a lot of areas we do that. And because when we do that, we also can address some of the issues within the police force or within the folks who are part of the second chance job seekers. And we can really connect with them and say that we can give them an opportunity for some folks who are second chance. In fact, I'm very proud of Workforce Board because we have those opportunities. We have those job fairs for people with second chance. We have for job fairs for people who are disabled, people who are veterans. And that's the key thing that I love about what we're doing in the Workforce Development Board is to kind of reiterate to the employees and the employers that, hey, we are here to help you. No matter where you are as an underserved community, socioeconomical status, whether you're looking at race, gender identity, sexual orientation, or whatever you're going through, mental health, we are here to help you. And that's the story, and that's the message that the employers feel like, wow, there is a whole organization in Ventura County that really supports this underserved communities, and it's not that we are doing it all alone. I think that's really important for all the organizations and employers to think about. So, yeah.
Thank you. Yes, that is the work of the Workforce Board. And it's,
Mm,
by statute, our federal funding, the law that puts our funding into place, is designed for local communities to work with people in your community who have had barriers to employment. So if that's involvement in the justice system or a disability or a veteran or any barrier to employment, to train and upskill those individuals and connect them with employers who are looking for that talent. And then we can also provide supportive services and case management to ensure that a person is successful and that that employer really gets what they need. So
absolutely.
that, yeah, and bringing that together with certain industries, it does enable, for example, the healthcare industry to hire more people locally here in the community to serve the local community at the same time.
Exactly.
All right. Well, just a couple more things. This has been great. The time has flown as we've been here focused on healthcare. And we really appreciate a shout out to our listeners. We appreciate that we've gotten some new listeners. I think folks like the format of getting this information and getting something that they can take away and find useful. Um, I'll wrap up with this question and then we'll throw it back over to Doug. What is one piece of advice, Celia, that you would offer to first the job seekers who are pursuing a healthcare career, and then secondly, the employers who are still trying to strengthen their workforce?
I think for the job seekers, we need to help them understand that there are opportunities in the healthcare industry. It can be, like always, I mentioned the five pillars, the four pillars. So, if you are looking for a career in the healthcare industry, it can be in all these areas. It could be in the Department of Public Health, Department of, especially when you're working with the pharmaceutical companies, the biotechs today in Ventura County. I have been consulting with Amgen for more than 10 years. So I know that they are always looking for interns within our community. They're always looking for interns within our county, and they want to create these programs, and they have an R&D department that's also opening in the Ventura County, which was in the news recently. So we have opportunities there. What can you do in order for you to be ahead of the curve in looking at it more as an opportunity where you can be part of any research programs as an intern, or think about any opportunities where you can volunteer. Volunteering is one way of just helping and getting to know about the healthcare. But start with volunteering if you don't get a job. I volunteered for an organization when I was in my early 20s. I just volunteered to just help in a library, and that actually got me a job. I developed a library information system, and I just volunteered, and that really helped me build that the library information system. Then later on, my career completely went into research and DNA research. But I believe that anything that you can do to volunteer in any healthcare companies, if you don't get an internship, at least tell them that you want to volunteer and find an opportunity. Just put your foot in the door. For job seekers, find your foot in the door. That's really critical. For employers, I think it's important for you to understand that as an employer, you're here to help the community. And the more you have and the more passion that you see that the community here, everyone is willing to help and support you, I think the better it will really help in looking at the workforce. And if you can also tell us what are the areas you can focus on, like for instance, Amgen is now looking at R&D. Now they can give a little list of things that they want to do and what they're looking for the new talent, and we can even create a training program working in collaboration with Amgen. And we are actually thinking about all this and finding a way to look at all the different healthcare organizations in Ventura County and find what kind of opportunity can we create within community colleges, within schools, and how can we leverage that. And a lot of times this AI buzz is there, right? We have a lot of AI buzz going around. It's good to know about AI, but AI has been always around since 1950s. Let me say this. It started sometime in 1950s, but we need to look at it as a human-centered design. So even in healthcare, sometimes we get carried off in the technology, and I work with a lot of Actually, a lot of Silicon Valley companies and especially the startups today, and they're so caught up in healthcare that sometimes they forget all the nuances of really understanding is the healthcare is care for a human being, is a human care. And that's the most important thing. So healthcare equals to human care, and human care means it equals to healthcare for all. What do we need to do? Any technology that we need to change, how do we create the processes around it? How do we bring in people around it to create those changes? That's how the employers need to look at the workforce, the way in which they can really, really move the workforce button pretty fast and be a nimble, be an innovative company, and be an organization that's really focused on human beings. And that's what is more important. So I want to just leave our audience with that thought.
I was just going to say, I don't think there's any better sentiment to close on is that healthcare is human care. Thank you so much, Celia. Doug?
Absolutely. So I definitely, Celia, you absolutely, that is the last word. I'll just share with you really quickly just two things that jumped out at me from this conversation. I mean, it's so rich. But one is the idea of focusing on healthcare access and equity for all. I think that is something that sometimes gets lost. And then the other one I think that really jumped out at me that sometimes people forget is when, people say, have you considered working in healthcare? And people think, oh, I got to go back to med school. I have to go to nursing school. I have to, whatever it is, right? And
Mhm.
to realize that that is not necessarily that is not the only path into the healthcare industry. And that's a good reminder because I think even for myself, that's the first thing that jumps to my brain when I think about healthcare. So really great conversation.
Yeah, if it helps the audience, I don't have a medical degree. Right. I don't have a medical degree. I've been in the technology space, but the way I look at it from the outside, it really helps in moving things forward. I've been training nurses and doctors as well. Sometimes you train people, bring that awareness from the outside to inside and opens the mind a little bit because they're so caught up in work. I know it's very important. But yeah, it's really helpful for us to think about it that way. But thank you. Thank you for the opportunity.
Absolutely. And I'll just share real quickly for those who would like to learn more about the Ventura County Workforce Board, you can find us at workforceventuracounty.gov, workforceventuracounty.gov. That's new. We've changed from .org to .gov. And on there you can also find the calendar if you would like to attend one of our workforce sector working groups. Reach out, let us know, join the conversation. Thank you.